The Philippine Nurses Association of Nevada now brings you Filipinars, news and features about the Filipino-American nursing community and beyond. And now, here's your host, Doris Bauer.
Well, hello to all you Filipinars listeners and followers. Thank you so much for tuning in today. We certainly do appreciate it. And as you know, Filipinars is brought to you by the PNANV, or the Philippine Nurses Association of Nevada, in collaboration, of course, with PHLV Radio. This program is also available on PHLV Facebook, the PNANV website, Amazon Fire TV on demand, and wherever you can access your podcasts. Okay, so before I get to the program, I just would like to remind everyone that May 7th is the 30th anniversary of PNANV, and we are going to have a gala celebration. So if you haven't asked to join, let us know. Okay, thank you. All right, so today we are going to explore the impact of LTACHs, LTACH, in healthcare, and it's better known as the long-term acute care hospitals. So LTACHs are designed to help patients advance their recovery when traditional hospitals may not have the time or resources to help them. So today we have some special guests, and joining us via Zoom to help us explore LTACHs. Please welcome Mr. Al Wazwaz and Ms. Francesca Marbury from Kindred Hospital. Welcome.
Hello.
How are you guys?
I want to say congratulations to the Filipino Nurses Association for 30 years of service. Again, congratulations from all of us at Kindred to you guys.
Awesome. Thank you. Thank you so much. Yeah. 30 years is a long time, eh? Yeah. Okay, well, let me have you introduce yourselves, because I know that Mr. Al was here is the CEO of Kindred Hospital in Flamingo. So, Al, can you say something about yourself?
Yeah, absolutely. So, hello, everyone. My name is Al Wazwaz. I'm the CEO here at Kindred Las Vegas Flamingo. We are a 66-bed long-term acute care hospital located here in Las Vegas. Prior to my current role, I was the CEO of Kindred Hospital Chicago Central. I have my undergraduate degree from the University of California in exercise biology, as well as my master's degree from the University of Minnesota, and that is in healthcare administration. And some of my career goals and aspirations as far as healthcare operations is really to try to decrease the fragmentation of delivery systems in order to provide that patient-centric quality care for all.
Fantastic. Yes, we do need administrators like that. That should be, that's a great goal. And Ms. Francesca here, Marbury, is
I'm so happy to be here. Again, my name is Francesca Marbury. I am the Area Director of Sales and Marketing for Kindred. I cover both the facilities, so the Sahara location. I also partner with Al at the Flamingo location. My background is I have 23 years of experience in the pharmaceutical industry and sales and marketing. I'm also finishing up my MBA at UNLV. And so I'm so excited about that. And I just am so excited to join the organization and just to really learn from our great leaders like Al and Bud.
Yes, looks like two people here that are really great. Anyway, I have a few questions for you so we can explore really the impact of LTACHs to healthcare. So just feel free to, answer them, okay? All right. So what is LTACH? Anyway, can you give a definition of that?
Yeah, I'll go ahead and take that first one. The LTACH is a long-term acute care hospital. And at Kindred, we have 2 locations in the Las Vegas market. So we have the Flamingo location, which is a 66-bed facility over there off of Flamingo. And our cross streets would be between Maryland Parkway and Eastern. Oh, I have that right?
Yep, that's
and then our second location is our Sahara location. That's a 52-bed facility. It also has an HBO, so hypobariatric therapy. And that location has 52 beds, and it's over there off of Sahara, right between, I would say, Jones and Decatur.
Great, great. Okay, so, there are certain terms that have been thrown out there after a patient gets out of a hospital. It's the LTACH, and then the Sniff, or the SNF, which is a skilled nursing facility, and an IRF, or the inpatient rehab facility, right? Mm-hmm. Okay, correct. So, but Kindred is the LTACH, right? Okay.
That's correct.
So what is the difference between an LTACH, a Sniff, and an IRF?
Do you want to take that one now?
Sure. Okay. So really, and I will say, I'll preface that this is a common myth with long-term acute care hospitals. We actually do provide just that acute care. Similar to what you would get in a short-term acute care setting, we do care for those patients that have an acute care that requires a longer period of time for recovery outside of that traditional few days to a week in what we call the short-term acute care setting. So for us, it's still providing that same level of care, providing physician coverage, 24-hour clinical care, 7 days a week, to really help you progress on your journey to wellness. And so our goal is really to diagnose and stabilize your condition, help you recover, and then move you along the care continuum to those lower level of cares, which would be your skilled nursing facilities, your acute rehab, or your inpatient rehab facility.
Great.
So at our level, we are still trying to stabilize your acute care episode before we're ready to discharge you to one of those lower levels.
Okay, great, great. So the complexity of care, I guess, differs a little bit, and the level of therapy. So the LTACHs are more on the higher level. Okay. Absolutely. What about staffing and cost-wise? What can you say about that between the three?
Yes. So our staffing, the providers that come to our location, and our staff is made up of our MDs, DOs, nurse practitioners, physician assistants. We also have physical therapy, respiratory techs, OT, speech therapy, CNAs, pharmacy, pharmacists, pharmacy techs, radiology, case management. We have an excellent case management team, dietitians. And like I said before, over at the Sahara location, we have our hypobariatric oxygen therapy and their team, really specializing in helping patients with wound, respiratory, and also, I'm not sure if you know, Doris, but our ICUs, our ICU beds are the only licensed LTACH ICU beds in the state of Nevada.
Wow.
So we really have an excellent high care of
level of
being
care,
able to really care for the serious patients, ICU patients.
I did not know that. Thanks for letting us know. That's great. So, Kindred, what LTACH? What types of patients do you typically admit, diagnosis-wise, and things like that?
You want me to take that, Fran?
Yeah. Go ahead.
Yeah. So our primary specialty, as far as our patient population, are those that are intubated on a ventilator. Really, any other types of respiratory failure diagnoses. We really specialize in weaning patients off of ventilators, high flow nasal cannulas, etc. We also deal a lot with complex wounds. Now that can be just stageable wounds from DTIs and other things to surgical wounds as well. We maintain patients that have chest tubes in place, patients that are on multiple drips that require an ICU level of care still. And really anybody with neurological deficits, cardiac disease, renal failure. Wow. We do a lot of bedside dialysis here. Other infectious diseases that require kind of a long course of IV antibiotics. And really a lot of other chronic conditions, multi-system organ failure, etc. So we do cover quite a bit of complexities as far as our medical care.
Oh, great, great. So in your ICU, how many beds do you have there?
Here at Flamingo, we have an 8-bed ICU.
8-bed ICU. Awesome, awesome. So what is the typical length of stay of the patients in your facility?
I'll take that.
Okay.
Our typical length of stay really depends on the patient's need. And that's going to be coming from the acute care facility. And so some of our patients are with us for 7 days, and some patients are with us for 120 days. So it really is dependent on their diagnoses and the care that's needed for them to get them to the next level, either to another step down or back to their home.
Okay, great, great. So when the patients are ready to transition back to their homes or say in a different level of care, a lower level of care, what kind of assistance does Kindred or an LTACH provide for the patient and their families for the transition?
Yeah, let's first start with discharge to the community, which is what we consider home or home with home health. We have a full case management department here, and they really do coordinate with patients, with their loved ones, to really ensure that they have access to the durable medical goods that they need. A lot of the times that'll be a wheelchair, a walker, a wound vac if they need it for the home care setting. They will set up home health if it's required for the patient, as well as outpatient dialysis, if that's a requirement as well. They'll make sure that the patients have access to all their prescriptions, so they can pick up their medications and set that up with their pharmacy. We'll schedule PCP appointments as well. We want to make sure that the patients are following up with their primary care provider. And if they don't already have one in the community, then we actually go ahead and we obtain a primary care provider for them. So we want to make sure that they're continuing on with that checkpoint to make sure that they're not readmitting back to the short-term acute care setting.
Okay.
And really any other needs that arise. But our team really does take care of that. We will send the referrals off if they're going to just a lower level of care, like a skilled nursing facility or inpatient rehab. We'll go ahead and we'll set up those referrals. We'll make sure that we get the insurance authorization prior to you admitting to those facilities. So we really are with you every step of the way until you discharge from our facility.
That is fantastic to know. And I work in the home infusion arena. So that's sort of like handing off, with everything that the patient needs is covered, so that there's a smoother transition, because it's difficult when we get to the home and we're like, okay, you have wound care. So where are your supplies? And did they give you a referral for a wound care company? No. So those things, they are pretty important. So that's great. That's good. That's good. So, anything to add to that, Fran?
No.
Oh. Okay.
Definitely has that covered.
That's good. So you talked a little bit about the different healthcare professionals that work in your facility. What are, of course, you have to mention the nurses, right? What are your current challenges with staffing? Because I know everybody is in dire straits, mostly healthcare.
Yeah, I would say much like the rest of the country, we felt that strain that came really during the COVID pandemic when it came to staffing in our workforce. And, it was for a multitude of reasons. Either staff were moving on to that travel or those agency positions, or they were just leaving the healthcare industry en masse. It really was a tough time for all of us, from the front line to the operational leaders in all buildings. Now, I will say, as the COVID pandemic has continued to subside, we have been staffing and we've seen it stabilize once again. So we're grateful for that.
Good.
But we're always looking to recruit. We always want to try to get the best and the brightest here at Kindred Hospitals. So I'm going to make this kind of my shameless plug. But if you're interested in working for long-term acute care hospital, we would love to have you here. Please visit our website, our careers section. And we have a hiring event coming up on May 18th. So stop on by if you're interested and you want more information on us.
Oh, there you go. That's great.
It's such a great company to work for, and our leadership is amazing. And so at Kindred, it's really like a family, and it's just an opportunity to come and really bond with patients. You really get to know your patients. Sometimes in the acute care setting, you're with that patient for 5 days, 7 days. However, with our patients, you're there with them. Sometimes, like I said, sometimes it's 7, sometimes it's 120, but you're able to really see the patient progress. And the environment's an amazing environment and excellent leadership. So if anybody's interested, please go to kindred.com and our careers page.
Okay, wonderful. I'm sure we'll see what your event is on upcoming one. So we'll see what we can do. Okay, so nursing is typically the heart of patient care. I'm sure you do agree with that. What do you think is the main difference between nursing care in the hospital setting as compared to an LTAC?
I'll start with some of the similarities first, if that's okay.
Sure.
As I noted to earlier, we really do provide the same level of care that you would get in a short-term acute care hospital. Even when we talk about our nursing ratios, they are in line with the acute care hospitals across the community. Our med tele, we run a 6-to-1 ratio. Our IMC is a 4-to-1 ratio, and our ICU is a 2-to-1 ratio.
That's good to know, you guys listening out there. Okay.
We love to maintain those ratios. And to Fran's point that she just made, we are a smaller facility. And I think that's one of the main differences between us and the larger short-term acute care hospitals. Is that you do feel like a family here. And we all get to know each other really well, from the front line to the leadership. Everyone's really encouraged to work together, to communicate across those departments, to really keep everybody in the know. So everything is transparent out in the open. And we encourage staff to come. I love it when staff come to administration just to speak with me, just because they're wondering what's going on. I love that. And I love going to the floor. I'll wear my scrubs a couple days a week. I'll be out there rounding. If you need help with something, let me know. I'm there to help you and support you. And on top of that, it really is the relationships you build with the patients here.
Right.
It's not a 3 to 4 day turnaround time. You do get to spend a lot of time with the patients and their families, and you build those connections with them. I love it when I get reviews, Google reviews and other things. And people mention how, you have nurses on night shift. Faye specifically, I will call her out on this. One of my favorite nurses on nights, and she sings to patients.
Oh, wow. That's fantastic.
Right. It makes a huge difference for them in their recovery to kind of feel that love and that connection from the staff.
Yeah.
So I love that. I love that we're there for them and that we can build those relationships with them.
Well, I'm so glad that you're clarifying, the way patient care is done there. So and it's a different perception maybe from some of the, healthcare workers who may be wanting to switch careers or something like that. So I'm glad we're doing this.
Absolutely. Me too.
Good. Okay. So we were talking about the COVID pandemic difficulties. And I know that LTACHs and Sniffs, they, really had a bad rap, at the height of the pandemic, because where else are you going to put them if, they don't have any beds in the hospital? They go to like the LTACH or the Sniffs, right? So with the still ongoing COVID pandemic, LTACHs and skilled nursing facilities have really played a critical role in caring for COVID patients. So can you give us an idea of how the COVID pandemic has affected your facility from the height of the pandemic to today?
Absolutely. So we were really on the front lines of the pandemic. We started taking COVID positive patients in April of 2020.
Wow.
So really a month into the pandemic, we converted 12 of our rooms into negative pressure rooms. And we started taking COVID patients really to help the short-term acute care hospitals decompress in their ERs and their ICUs, and really just help them out with their patient flow through their building. And so we continue taking them even today. We just admitted a COVID positive patient just about a week ago.
Wow.
And so we are going to continue to be that community partner. We definitely want to do our part to care for these patients, to help our partners in the community be able to continue to see the patients so they're not running into any bed capacity issues. And I truly believe, we are the ideal location for COVID patients. I prefaced it earlier, but long-term acute care hospitals, we do a great job weaning these patients off of ventilators and off of high flow.
Right.
Early on in the pandemic, when we didn't know better, we were intubating all these patients. We were getting them on ventilators. I'm appreciative that we learned from that and realized that that wasn't necessary, and we were able to move on to high flow nasal cannula instead. But throughout it all, we adapted. We changed the way we practiced. We made sure we had the equipment necessary to care for these patients. And we continue to see multiple successes in our facility. Patients being able to, discharge home, be with their families again. And we consider those are always successes for us.
Yes,
to be able to get patients back to the community.
Yeah. And that's really good information to disseminate to the public because, they just don't realize, the impact that you guys, facilities like yours have done for the community and the pandemic. All they hear is some negative stuff, and they really need to know the truth. So thank you for clarifying that. Okay. There, like I said, misconceptions, talk about that. There are a few myths about LTACHs there, which we sort of kind of need to clarify. And you already gave us the difference between an LTACH and a nursing home. So some of the myths are and feel free to just answer. One of the myths says patients are admitted to an LTACH are required to stay 25 days. True or not?
That is false. So I think where people get confused is there's actually a CMS guideline, and that guideline is what distinguishes us as a long-term care facility or long-term care hospital, is that we do need to maintain for CMS a 25-day length of stay during the cost report year. That is actually a requirement for us to have that designation as a long-term acute care hospital. Okay. However, for those patients who are not Medicare or managed Medicare recipients, for example, your commercial, your Medicaid, your managed Medicaid, that is not a requirement for any of those payers to maintain that length of stay.
Good.
However, with that, CMS really understands, and so do we, that not every patient needs a longer length of stay. DRGs will vary between 15 days to really 40, 50 days.
Right.
And it really is an average of our payer mix.
I see.
Or of our patient mix. Okay. And depending on what that DRG is, they'll fall in line with a certain number of days. However, our goal, and it's always been our goal, and I'll say specifically even my goal just as a healthcare leader, is I want to get these patients out of this setting and on either the next setting or home.
Yeah. That
is our ultimate goal, and it always will be. So if you're ready to discharge in 10 days, we are discharging you at 10 days.
Awesome.
So that's really how we like to operate here.
Wonderful. Okay, another thing is I say, patients do not get physical therapy or occupational therapy in an LTACH. Is that true or false?
That is also false.
Okay.
So, we have a full rehab department at Kindred Hospitals. It includes physical therapy, occupational therapy, speech therapy, and we also have our restorative program as well.
Okay.
And each one of our patients upon admission are evaluated and assessed by each discipline for the appropriateness of their care. So if it's a patient that can benefit from PT, OT, that is going to be scheduled and they're going to receive those services in our setting, as well as speech therapy. And if, they're just maintaining, they already have a high level of function, they'll be part of the restorative program, just to strengthen them a little bit more before they discharge.
Oh, good. Well, you already clarified this next myth I was going to ask you. LTACHs cannot accept ICU level patients or patients on an IV drip. That's false, right? Yes.
That's really
Yes.
That is false.
We have those licensed ICU beds. We're the only one in the state.
That's fantastic.
Only LTACH in the state.
Okay, so the other one is a patient must spend at least 3 nights in an ICU before getting admitted to an LTACH.
So this is another CMS regulation.
Uh-huh.
So I think we're going about 6 or 7 years now, CMS came out with what they deemed criteria for a long-term acute care stay. And they did that in order to really assess the appropriateness of the level of care that patients were utilizing.
Mm-hmm.
And so for us, if a patient meets LTACH criteria, they would have had to stay in the hospital in an ICU setting for 3 midnights. But there are other criteria as well, like being on a mechanical ventilator for greater than 96 hours. However, those patients that don't meet that criteria, CMS believes that they are better suited for a skilled nursing facility, inpatient rehab, etc.
Okay.
And so in order to really, utilize, and I know what CMS was doing and why that requirement came out, and it's something that was needed across the healthcare industry. But that is really just a CMS regulation. If you're, any other payer, the 3 midnights don't apply to you, and we could admit with 1 midnight.
Okay.
It really does depend.
CMS being Medicare for all those who don't know, right?
Correct.
Okay.
Yeah.
All right. So the other thing is, and I'm sure this is not true either, they say insurance doesn't pay for an LTACH. Yes,
Absolutely
they do.
And we obtain authorization from insurance companies prior to the patients admitting here. So we make sure that the insurance company is going to be covering the stay for the patients.
Do you do you accept any pending Medicaid? Do you accept Medicaid? Is that what?
We do accept Medicaid.
Uh-huh.
We will also try to get Medicaid for patients while they're in our setting as well.
Uh-huh.
Usually that is a requirement to discharge patients to skilled nursing facilities and other levels of care. I wouldn't say a requirement, but it's encouraged just for those longer length of stay patients. So if you don't have Medicaid, we will actually try to get you Medicaid while you're in our setting.
Great. Okay, well, that's great. And it sounds like your facility is really wonderful. I do have some pictures to show the listeners and the viewers while I ask you this question. Okay. So given the high numbers of hospitalized patients who need continued complex medical care and rehab that cannot be afforded in acute care setting, how can Kindred Hospital help?
And you want me to take that one? Sure.
Yeah.
I've always talked about Kindred Hospitals really being the stepping stone between the short-term acute care hospitals that are continually needing that bed capacity due to the acute medical conditions, and then the lower level of cares like a skilled nursing facility or inpatient rehab. So through our programs and the care that we provide, we give patients more time to recover, and we can afford that to these patients to recover, to heal prior to being discharged back to the community. And I think we do that very well. So our ability to really help those patients find that hope and find normalcy in their lives, it's one of the greatest feelings that I know I have as a healthcare professional, and I'm sure everybody else who works for Kindred Hospitals feels.
That's good. Okay, well, great. Thank you so much for that. And yeah, it's a very nice facility. I've been there actually. So what is the address and the phone number to call Kindred? I think we have. So
our address is 2250 East Flamingo Road, Las Vegas, Nevada, 89119.
Okay. Very good. And I think I have a snapshot of your address on the screen too. So, okay. Well, guys, thank you so much. Mr. Al Wesworth, and Fran Marbury. Always good to talk to you, Fran. Thank you, Fran and I have a long history.
We have that recruiting event, everybody. Come out May 7th, 18th.
Okay. All right. That's great. May 18th. So we'll look forward to that. But anyway, thank you so much for joining us today to talk to us about LTACHs. We truly do appreciate it. And your facility looks like one of the finer ones out there, right?
Okay. Yes, it does.
All right. Okay. Well, thanks again. And to our Philippine NARS followers, an LTACH, or a long-term acute care hospital, provides services for patients with medical requirements, such as management of several comorbid medical conditions, and those patients who are still ill enough to require a high level of complex care. So these patients do not need to stay in the hospital in the ICU or for emergency treatment. Their health is still relatively stable, but they still need or require a more sophisticated level of care. And LTACHs can provide a continuation of hospital-level care in a long-term care setting. So thank you so much for joining us today. Thank you for the privilege of your time. This is Doris Bauer, your Philippine NARS host, signing off for now.
The Philippine Nurses Association of Nevada has just brought you Philippine NARS, news and features about the Filipino American nursing community and beyond on PHLV Radio.